Hello and welcome to The Gentle Shift, Health by Choice, Not by Chance. I am Dr. Aaron Kiefer, and I'm thrilled to have you here. Today, I will be talking about posture, how it can cause issues, and how I am able to fix it. Given I plan to interview healthcare providers, I feel that I would be remiss if I didn't talk about what I do, how it's different, and how it helps. As you may have heard in previous episodes, I am a NUCCA doctor. NUCCA is an acronym which stands for National Upper Cervical Chiropractic Association. NUCCA doctors are specialists in the chiropractic field. We're upper cervical chiropractors, meaning we focus on the upper cervical spine. The upper cervical spine is the upper neck. Upper cervical chiropractors focus on the top two bones in the neck, which are called C1 or atlas, or C2, which is called axis. We adjust the top two bones in the neck to correct the rest of the spine. For the most part, once you set the upper cervical spine in a proper position, the rest of the spine will fall in place from there. If you recall from earlier episodes, the role of chiropractors is to remove any interference that may be occurring to the central nervous system. The central nervous system is comprised of our brain, and then our brain extends down into what's called our brain stem, and our brain stem extends down into our spinal cord, which carries all of the nerves that ultimately branch out and travel to all of the cells of the body. We believe there should be no interference to that transmission of signals. We often like to refer to as communication between the brain and the body. And we believe that the body will function better when communicating properly. Nerves are a two-way street. The brain sends signals down nerves to cells, and the cells report back to the brain telling of their current status. There are so many issues that are caused simply because the nervous system is not functioning correctly. When not functioning correctly, some tissues of the body become stressed and overworked, and breakdown will occur over time. Even though we are self-healing, the body can only heal to a certain capacity. Once breakdown occurs at a faster rate than the body can heal, then we start to develop signs and symptoms such as pain or dysfunction, like a decreased range of motion. We believe that by restoring the proper function and trusting in the body's own self-healing capabilities, that the body can start to catch up on healing to eventually bring the body back to full function. The mission statement in my business has changed over the years and is simply restore health. And it's to emphasize that we as living beings have an ability to function and heal, provided there's proper communication happening. And so my job is to restore that, to bring health back to those that may be suffering. The mission statement assumes that, number one, the body is self-healing. And number two, if injury occurs faster than the healing, that this can all be reversed and that health can return. So the first thing that I look at when evaluating someone, whether it's a new person or someone I've taken care of for a long time, is their posture. When most of us think about posture, we think about our parents or loved ones or a teacher telling them to sit up straight or stand up straight. And that would be the posture that you have a conscious control over. But that is not the posture that I'm referring to. Because the reality is most of us will only consciously think about our posture for a pretty short period of time. So I'm looking at that unconscious control of our posture. Essentially, our bodies have a baseline posture, and then we have adaptations of that as the body seeks comfort. So, one of the signs that there is improper communication between the brain and the body is postural distortion. If there is irritation in nerves, it will cause a signal that's moving along the nerves to get altered. So, that altered signal will travel along the length of the nerve and eventually arrive to the muscles. If it's a wrong signal, that muscle is going to either contract, which would be that the muscle is tense or tight, or it's going to relax. The muscle will maintain that level of tension. However, that is incorrect for the situation of what the brain wants. So when you have an imbalance of muscles, it will show a change in your posture. If you imagine the muscles on one side of the body are tight, then it will pull the body over and cause you to tilt in that direction. Believe it or not, the vast majority of our population, the extreme vast majority of our population, should have a perfectly balanced posture. The head should be perfectly vertical, your shoulders should be level, hips should be level with the ground and square over your feet. The upper body should be perfectly vertical. Any deviation from that, in most cases, indicates there's a misalignment that's causing irritation to your brainstem. If you're interested to know if you have any nerve interference, you can easily evaluate your own posture. Of course, some people have a better eye for their posture than others. If you just simply look in the mirror, you can evaluate and see, do your ears seem to be level? How about your shoulders? Does it seem like your upper body is in line with your hips? Does it seem like your hips are square over your feet? Does it seem like your hips are level? Certainly, if there's an obvious postural distortion, then you should get it checked out. So, what's a big deal with posture anyway? We live in this world that has gravity, and gravity has this equal pull. It's pulling our bodies down to the ground, and it's compressing us. Since we have this pull on us, it causes a force to be exerted through our body all the time. While we're standing and moving, gravity causes forces to go through our body. So every step we take is a shock that goes through the entire body. If we're balanced to gravity, the forces are fairly evenly distributed from one side of the body to the other. Our body was designed to absorb forces. However, it absorbs forces better when those forces are equal side to side. The body likes to be balanced. As you can imagine, if you have more force constantly going through one side more than the other, say it's a muscle or a joint absorbing perhaps 1.5 to 2 times more force on one side compared to the other, you can see how it's going to cause that side to break down sooner. As we talked about before, the body has an ability to heal itself. However, the secret is we need to be taking in less insults and traumas on a daily basis than the body can heal. We can only heal at a certain rate. So if you start to receive micro traumas that are occurring at a faster rate than the body can heal, then breakdown will eventually occur. If you're receiving more force going through the body on one side, then that side may eventually break down faster than the healing process can repair the damage. And eventually that breakdown becomes significant enough that signs start to develop. So if we're talking about muscles or joints, that means that eventually you will have some form of pain or dysfunction, such as a loss of range of motion. Sometimes you have bigger signs, such as perhaps some bone spurs or joint spaces that become smaller due to that long-term pounding on the joint in an unbalanced way. It's only a matter of time before an unbalanced posture is going to cause some breakdown to occur. So when someone comes to the office and they describe their particular issues, I look at their posture, and oftentimes I can make direct correlation between the posture I'm seeing and the breakdown that likely occurred from that posture. Obviously, some cases are more complex to figure out than others. When I see postural distortion, the first place I look is the spine. I will take x-rays and I look at the orientation between the head, the top of the neck, which is called, once again, the atlas, and the rest of the neck. You see, our posture ultimately is controlled from an area that's called your brainstem. Your brainstem is the extension of your brain. Your brainstem goes from the base of your skull down about 2 to 3 inches. All of life's important functions that keep us alive are in the brainstem. There's areas that control our breathing, our heart rate, our blood pressure, sleep, and our posture. And those control centers are all very close to each other. The interesting thing is, as a byproduct of the adjustment and the removal of interference in the brainstem, people see other issues clear out or improve, such as blood pressure and sleep. So I look at that area to make sure there is maximum room for the brainstem to sit. Our brainstem and spinal cord are supported and held in the middle of our spinal column by what are called dentate ligaments, which are these very fine fibers that connect the outside covering of the spinal cord with the vertebrae to hold the spinal cord suspended roughly in the middle of the spinal canal. And the spinal canal is the opening that the spinal cord sits in. So even if vertebrae are shifted just a small amount or nowhere close to actually touching the spinal cord, or the nerves exiting out from the spinal cord, that shift can still pull on those dentate ligaments and cause localized irritation to the spinal cord, which ultimately causes irritation to the nerves. When there is a misalignment of the vertebrae causing irritation to the nerve, in the chiropractic world, we refer to that as a subluxation. Our nervous system is extremely complex and extremely delicate. Our studies show that nerve irritation can begin once the bones have shifted away from their normal alignment by more than 1/2 of 1 degree. And when I'm referring to degrees, I'm referring to the actual geometric measurement done with a protractor. So if you remember back in the day when you would have to use a protractor to draw a 90-degree angle or a 95-degree angle, the difference between having proper nerve function and having some irritation to the nerves can be the difference of going from 90 degrees to 90 3/4 degrees. It's such a tiny range between proper function and possible irritation. So I take these extremely precise x-rays. Most x-rays are not taken to the precision that is necessary for NUCCA doctors to evaluate the x-rays. People sometimes will come in saying they already have x-rays, and while I'll gladly look at them, it's almost a guarantee I'm going to be taking my own x-rays. Unless, of course, those x-rays were taken specifically by a NUCCA doctor. Once I have the x-rays, I start to analyze them. So I use our digital software to make a lot of points, to draw a bunch of lines on the x-rays. I'm taking a bunch of measurements to determine exactly how the spine may have been deviated from being perfectly balanced. And I take those measurements, I plug them into a formula. The formula ultimately calculates a vector or an angle that needs to be used to move the spine in the way that needs to be moved. This technique was designed through the collaboration of a couple chiropractors and some engineers. It actually started just a little bit north of where I'm living in Monroe, Michigan is where it originated. So engineers were vital to be able to construct this formula. And so there's a lot of factors that are taken into consideration by the formula. Ultimately, I get an angle that when force is applied at a specific place, it should shift the spine into the correct position. There is actually close to 100,000 different angles on each side of the spine that can be used. So every single person gets a customized adjustment that works for them and likely only for them. What's great is when we have the correct angle to adjust the spine, we do not need to use very much force. Most people think of a chiropractor and they think of that bone cruncher, and that is not at all what NUCCA is. The adjustments are extremely gentle. They are gentle enough that I have had people fall asleep during the adjustment. Most people do not even realize they're adjusted because when they're laying there, they're waiting for some big force to be done or performed, and that doesn't happen. So, extremely precise and an extremely gentle adjustment. The really cool thing about NUCCA is after the adjustment, immediately after the adjustment, the person's posture changes. Very rarely does a posture not correct to perfectly balanced. We see immediate changes. So then we do something after the adjustment that's extremely rare in the chiropractic field. We take x-rays after the initial adjustment. I want to see how your spine corrected. I want to ensure it corrected exactly how it should have. I don't assume that everything corrected exactly how I wanted. Even though the formula to determine the angle is very powerful, it is not always 100% correct. There's so many things that cannot be taken into consideration, including possibly asymmetry of the joints of the spine, or even asymmetry or unbalanced muscles. So those x-rays help me figure out what kind of correction we actually achieved. I want to double check my work. It is very common that when looking at the x-rays that there is something else that may need to be changed in how I'm correcting that person's spine to get a better correction. Often I need to change a factor to the adjustment, such as the angle that's used, the location where I contact the person, or the person's placement of their head and body during the adjustment to achieve a better correction. I'm always seeking to get the best correction possible in somebody. Better corrections lead to quicker results and longer lasting results. And call me crazy, but my goal when I take care of someone is to get them to the point that they do not need to come in for care all of the time to see results. I prefer for care to eventually be something that isn't needed very frequently. NUCCA is the most researched chiropractic technique. It is the most precise chiropractic technique, and it is the most gentle adjustment. I often get asked why there are not more doctors that are doing NUCCA, and I wish I knew the answer to that. I certainly can attest with my own personal experience that it is challenging to learn. And just like in any field, there are some people that like to specialize in something and many others that do not want to specialize for various reasons. So x-rays are taken right after the adjustment, and they also show immediate changes. I analyze them the same way I did the initial x-rays. The goal is to correct people's spines as best as possible. In the perfect world, we'd love to see a perfect correction every time, but that doesn't necessarily happen. I work to get the best correction I can, but sometimes misalignments might be too large, or possibly the body may not want to shift as well as I would like on that first day. There are many people that are in a work in progress stage. So we make initial improvements and then seek to make more improvements over time. Surprisingly, most people will do very well symptomatically with as little as a 10 to 20% correction. But I aim for better corrections because it's shown they lead to better results. Unfortunately, after correcting the spine and correcting the posture, people don't necessarily feel immediately better. As I mentioned, that postural distortion causes micro traumas and damage over a long period of time. So once we remove that damage from occurring and open up the nervous system to properly communicate between brain and body, we allow that self-healing process to catch up. Healing takes time. Healing takes time. It's something I cannot emphasize enough. So then, depending on what tissues have been damaged, will determine how long someone may need to heal. As you can imagine, problems that may have been going on for a longer period of time typically take longer to heal. If the issue the person has is strictly due to muscle damage, then that can be anywhere from 6 weeks to 6 months that it could take to heal. If the issue is related to damage to joints, then you're talking about anywhere from maybe 3 months up to possibly 2 years to fully heal. Nerve issues are a long-term thing and usually take 1 to 2 years or even longer to fully resolve. From this point on with care, my goal is to help the person to maintain the correction for as long as possible. With follow-up appointments, I adjust the spine when necessary to return the spine to a balanced state. So I check their posture on return visits to help me determine when they need to be adjusted. Over time, the spine will become more stable and the person will be able to maintain the adjustment for weeks, months, or even years. I merely set the ball in motion to allow the body to heal. It is certainly not a quick fix as far as symptoms go, but the key is it's a fix, a correction of the root cause of an issue. It isn't covering up symptoms. When I do follow-up appointments, I see someone with a coy smile on their face as they tell me about how they are improving. It's always something that gives me goosebumps. I am unable to express how awesome it is to see someone getting their life back and hearing those stories of the things they can do that they weren't able to do before. So this is what I do. It is such a blessing to be able to assist people on their healing journey and to do so in a way that I'm working to simply free this intelligently created body to work in the way it was designed. My take-home message today, if you have issues that cannot be figured out, try something outside the box. Check your posture. See if you have any distortion. And if you do, give a NUCCA doc a call. If you aren't sure if you have a distortion, call up a professional and have them do a consultation and check you. You deserve to function well. You deserve to live your life to the fullest. If you have any questions, I'm always happy to answer them. Thank you for joining me today. For now, I will sign off. This is The Gentle Shift, Health by Choice, Not by Chance. I am Dr. Aaron Kiefer. Be well.